Did you know that according to the CDC, 99% of deaths after age 75 stem from just 5 major causes? What's truly shocking is that 80% of healthcare providers admit these conditions are largely preventable with simple interventions. Many Americans assume declining health is simply the price of aging, but groundbreaking research from the National Institute on Aging reveals something surprising. Your daily habits matter more than your genes in determining how well you age. Today, I'm sharing evidence-based strategies that can add quality years to your life, regardless of your current health, budget, or background. We'll explore each risk, what Medicare covers, affordable options for everyone, and practical steps tailored to your specific situation. I've helped thousands of seniors regain control of their health, and today's information could literally add years to your life. Type "ready" in the comments to let me know you're joining us today. Let's start with America's #1 threat to seniors, heart disease, and why it's never too late to protect your heart, even on a fixed income. Number 1. Heart disease, America's #1 senior health risk. In this section, we'll cover heart disease, America's leading cause of death for those over 75, and the specific steps that can protect your heart at any age or stage. Heart disease claims more American senior lives than any other condition, but here's the good news. It's never too late to strengthen your heart, even in your 70s or 80s. A groundbreaking study from the Mayo Clinic found that adults in their 70s who adopted heart-healthy habits experienced measurable improvements in cardiac function within just 3 months. Heart disease isn't simply inevitable aging. CDC statistics show dramatic differences in heart disease rates among seniors living in different regions and from various backgrounds. This proves that lifestyle and health care access play crucial roles regardless of age. Consider Maria, a 78-year-old Cuban-American from Miami living on Social Security. After her mild heart attack, she couldn't afford expensive gym memberships or specialty foods. Instead, she connected with a free community walking program and learned heart-healthy modifications to her traditional recipes. Within 6 months, her blood pressure normalized and her energy returned. Or Robert, a 76-year-old from rural Nebraska with limited access to specialists who used Medicare-covered remote doctor visits to get personalized heart care without traveling hours to a major hospital. Your heart health plan should match your specific situation. If you have existing heart conditions, focus on medication management. Ask your doctor about Medicare, Part D assistance programs that can save hundreds annually. Try simple at-home activities like seated exercises. Learn the early warning signs of complications. Remember that Medicare covers cardiac rehabilitation, a benefit only 24% of eligible seniors actually use. For those with risk factors like high blood pressure or cholesterol, schedule your free Medicare annual wellness visit, which includes cardiovascular screenings. Local pharmacies offer free blood pressure checks, and many grocery stores provide heart-healthy shopping tours at no cost. Even if you're currently healthy, simple habits like a 10-minute daily walk and reducing sodium by reading food labels cost nothing but significantly protect your heart. You don't need expensive technology to monitor heart health. While smartphone apps can track activity, simple paper logs work just as well. Community centers often offer free blood pressure checks, and many libraries host heart health education programs. Have you gotten your free annual Medicare wellness visit this year? Type yes or not yet in the comments. Your response might remind someone else to schedule theirs. While strengthening your heart is vital, there's another threat that can compromise your independence overnight: falls. In fact, many heart medications that save lives can actually increase your fall risk. Let's look at how to protect yourself from both. Roster 2. Falls and injuries, the independence threat. In this section, we'll examine how falls threaten independence for seniors of all backgrounds and the simple, often free modifications that can protect you. Falls may not sound as serious as heart disease, but they're actually the leading cause of injury among Americans over 65. The CDC reports that 1 in 4 seniors falls each year, resulting in over 3 million emergency room visits. After a first fall, many seniors become afraid to move around, creating a dangerous cycle of decreased activity and increased weakness. Most falls are preventable with changes that cost little or nothing. What many doctors don't discuss is how commonly prescribed medications significantly increase fall risk. Blood pressure medications, sleep aids, and even some over-the-counter allergy medications can cause dizziness or affect your balance. A medication review could spot these risks before a fall happens. Consider Eleanor, a 73-year-old retired teacher from Chicago who had several close calls in her bathroom. Rather than expensive renovations, she made 3 changes that cost less than $30 total: a non-slip bath mat, a nightlight with a motion sensor, and moving frequently used items to easy-reach shelves. She hasn't had a fall since. Or Miguel, an 82-year-old in rural Arizona, who called his area agency on aging and qualified for a free home assessment that identified and fixed several hazards in his home. While preventing falls is critical, there are 3 key approaches to do so. If you have mobility challenges, Medicare often covers assistive devices like canes and walkers. Ask your doctor for a prescription. Check YouTube for seated strength exercises for seniors. Even 5 minutes daily helps. Simple home modifications like removing throw rugs cost nothing but prevent countless falls. For those with balance concerns, many senior centers offer free balance training classes. Medicare covers physical therapy to improve stability, a benefit many don't utilize. Ask your pharmacist or doctor to review your medication specifically for fall risk factors. Even if you're currently steady on your feet, practice stand-up exercises while holding your kitchen counter. Remove clutter from pathways in your home. Check that your shoes have good tread. Many falls happen from worn-out soles. You don't need expensive technology to stay safe. While medical alert systems provide peace of mind, with many Medicare Advantage plans now covering them, simple solutions like keeping a charged phone in your pocket work too. Strategic furniture arrangement, giving you stable objects to hold on to, costs nothing. What's one simple change you've made to prevent falls? Type your answer in the comments. Something as simple as removed rugs could help someone else. Falls can limit your mobility in an instant. But there's another threat that gradually restricts your independence by affecting something you do 20,000 times daily: breathing. Let's explore how protecting your lungs keeps you active and independent. Part 3. Respiratory diseases. Every breath matters. In this section, we'll look at how respiratory conditions become increasingly dangerous after 75, and the simple protection strategies that work for everyone, including those on Medicare or limited incomes. Breathing is something most of us take for granted until it becomes difficult. After age 75, respiratory infections like pneumonia and chronic conditions like COPD become much more serious. The American Lung Association reports that respiratory diseases are the 3rd leading cause of death among seniors, with rates varying dramatically depending on where you live and your previous exposure to pollutants. Here's something that might surprise you. Your indoor air can be 2 to 5 times more polluted than outdoor air. This applies whether you live in urban Los Angeles or rural Maine. Since aging lungs have less reserve capacity, clean air becomes even more crucial as we get older. Take Elaine, a 77-year-old from coal country, West Virginia, who struggled with breathing for years. She discovered her Medicare coverage included pulmonary rehabilitation, a benefit many don't know exists. After completing the program, she could once again tend her garden and visit with grandchildren without struggling for breath. Or James, an 81-year-old veteran from Los Angeles who improved his breathing through free VA programs that taught him breathing techniques and helped him create a clean air zone in his apartment. There are 3 key approaches to protecting your lungs. If you have existing respiratory conditions, learn about patient assistance programs that can reduce medication costs. Ask your pharmacist about these. Create a simple action plan with your doctor for what to do when symptoms worsen. Use a humidifier in dry climates or a dehumidifier in humid areas to ease breathing, both available used at reasonable prices. For those noticing early symptoms like shortness of breath, Medicare covers lung function tests when ordered by your doctor. Local health departments often provide free or low-cost smoking cessation programs. Simple habits like drinking enough water help keep airway secretions thin and easier to clear. Even with healthy lungs, get your annual flu shot and ask about pneumonia vaccines, both covered by Medicare. Create a dust-free sleeping area by washing bedding weekly in hot water. Open windows briefly even in winter to improve ventilation. It costs nothing, but makes a significant difference. You don't need expensive air purifiers to improve your breathing. While special air filters can help, simple steps like keeping houseplants, using damp dusting methods, and avoiding harsh cleaning chemicals improve air quality affordably. Many public libraries loan out air quality monitors so you can check your home for free. What's one thing you do to protect your lungs? Type your answer in the comments. Something as simple as open windows might help someone else who's struggling. While lung problems develop over time, our next risk can change everything in mere minutes. Interestingly, the same healthy habits that protect your lungs also reduce your risk of the 4th major threat, stroke. Here's what you need to know. Dunbar's stroke. When minutes make all the difference. In this section, you'll learn how to recognize the hidden warning signs of stroke that many miss, and the prevention strategies that work regardless of your healthcare access or budget. Stroke is often called a brain attack because it cuts off vital blood flow to part of your brain, and every minute counts. According to the American Stroke Association, someone in the United States has a stroke every 40 seconds, with risk doubling each decade after 55. What's heartbreaking is that many seniors don't recognize the warning signs until it's too late. First, while most people know the FAST method, face drooping, arm weakness, speech difficulties, time to call 911, fewer recognize the hidden stroke symptoms that can appear hours or even days before a major stroke. These subtle warnings, like sudden dizziness, brief vision changes, or unusual headaches, are especially missed in women, rural residents, and minority communities. Second, quick action makes all the difference. Consider Sarah, a 72-year-old Asian American woman in Seattle who noticed her handwriting becoming suddenly messy and felt unusually tired. Having read about these lesser-known symptoms, she went to the emergency room despite feeling silly for going. Doctors discovered she was having a mini-stroke and prevented a major one. Third, even in remote areas, knowing what to do saves lives. Thomas, a 79-year-old from rural Kentucky, recognized his wife's slightly slurred speech using the FAST method he'd learned at his church health fair. Despite living 45 minutes from the nearest hospital, his quick action prevented permanent disability. Your stroke prevention plan should match your situation. If you've had a previous stroke or mini-stroke, many state pharmaceutical assistance programs can help with expensive blood thinners. Create a simple emergency plan with family members or neighbors that doesn't rely on you making the call. Free support groups through hospitals help you connect with others who understand your experience. For those with high risk factors like high blood pressure or irregular heartbeat, print the expanded stroke warning signs card from the American Stroke Association website, or ask your doctor for one. Know which hospital near you is a certified stroke center. Treatment time matters more than hospital proximity. Even if you have low or moderate risk, check your blood pressure regularly at free pharmacy stations. Add more colorful fruits and vegetables to your diet. Frozen options are nutritionally similar to fresh, but more affordable and last longer. Walk 10 minutes daily to improve circulation. You don't need expensive technology to stay protected. While smartphone apps can help monitor blood pressure patterns, a simple notebook works too. Some rural communities have created stroke neighbor programs where seniors check on each other daily, which costs nothing but saves lives. If you know someone who could benefit from this stroke information, there's a share button below this video. Do you know all the warning signs of stroke beyond FAST? Simply type, "I learned something new" if this information was helpful to you. A stroke affects your brain in an instant, but there's another brain-related risk that sneaks up slowly. In fact, preventing strokes is one of the best ways to protect against our fifth and final risk, cognitive decline. Here's how to keep your mind sharp. Cognitive decline, protecting your mind. In this final section, we'll explore practical strategies to maintain brain health that work for everyone, regardless of education level, background, or financial resources. Cognitive decline ranks among seniors' most feared health challenges, more than cancer or heart disease for many. The Alzheimer's Association reports that while 5.8 million Americans currently live with Alzheimer's disease, what's less known is how dramatically rates vary across different communities, suggesting lifestyle factors play a significant role. Here's something most doctors won't tell you. Researchers at Johns Hopkins found that untreated hearing loss significantly increases dementia risk, yet only 20% of adults who need hearing aids actually get them. Medicare now covers hearing screenings during your annual wellness visit, a benefit many don't utilize. Consider Rosa, a 76-year-old grandmother with limited English proficiency who worried about memory loss. Instead of expensive brain training programs, she embraced her bilingualism, alternating days speaking English with her grandchildren and Spanish with her friends. Research shows bilingual seniors experience cognitive decline at slower rates. Access free resources in your community. Bill, an 80-year-old retired factory worker in Michigan, discovered his local library offered free brain health workshops and memory-enhancing book clubs designed specifically for seniors. Your approach should match your current situation. If you have diagnosed cognitive issues, your local Alzheimer's Association chapter offers free support regardless of ability to pay. Create a simple daily routine with visual reminders. Studies show structure reduces anxiety and improves function. Medicare covers care planning sessions to help families prepare, yet fewer than 1% of eligible seniors use this benefit. For those noticing memory concerns, get a thorough evaluation covered by Medicare. Many reversible conditions can mimic dementia, including medication side effects, vitamin deficiencies, or thyroid problems. Public libraries often provide free memory screenings. Stay socially connected through free community programs. Isolation accelerates cognitive decline faster than almost any other factor. Even with a healthy brain, challenge yourself with activities you enjoy that require different thinking skills. If you enjoy math, try creative writing occasionally. Limit news consumption to specific times of day. Constant negative news exposure increases stress hormones that damage memory centers. Prioritize sleep quality by keeping your bedroom dark and cool, both free strategies proven to protect brain health. You don't need expensive technology to keep your mind sharp. While some brain training apps can help, simple activities like having conversations about current events, teaching someone a skill you know well, or changing your walking route regularly provide similar benefits at no cost. Some senior centers loan out puzzles and games specifically designed for cognitive health. What's your favorite free brain-healthy activity? type one word like puzzles or walking in the comments below. We've explored the 5 major health risks responsible for 99% of deaths after 75. Heart disease, falls, respiratory diseases, stroke, and cognitive decline. It's essential to remember that these systems are all connected. What protects your heart also benefits your brain, while preventing falls helps maintain your independence to stay active and healthy. You've earned the right to healthy, independent years ahead, regardless of your income or background. The choices you make today can significantly impact your quality of life tomorrow. Take advantage of preventive services covered by Medicare, annual wellness visits, screenings, and vaccinations that too many seniors leave unused. Every community, rural or urban, offers resources to help, many at no cost. To stay informed about evidence-based healthy aging tips specifically for American seniors like you, please subscribe and tap the notification bell. In the comments, let me know which of these 5 areas you're focusing on first. Just type something like heart or falls. Your journey to a healthier future starts today.